And Mumbai civic body, meanwhile, has cleared the air on a lockdown in Mumbai. BMC Chief Iqbal Chahal has said that though cases are rising, there is no need of a fresh lockdown in the city. He said that there will be no additional restrictions also which will be imposed, and two big reasons for that is that first of all, the death rate is under control, and secondly, no shortage of beds being witnessed in the hospitals as well. Disha is joining us for more details. Disha, this is perhaps a sigh of relief for people that no lockdown, at least for the time being, is not going to be announced for Mumbai. If you can take us through what the BMC chief has said.
Well, definitely it is going to be a sigh of relief for the people living here in the city of Mumbai, because the BMC commissioner has categorically passed a statement saying that there is no need of a fresh lockdown in the city of Mumbai. Though he's saying that the cases are on the rise, but there is no need of a fresh lockdown because it doesn't look like an emergency situation on the ground level. In fact, he also went on to say that the existing rules are okay and there is no need to perhaps impose another new additional restrictions in the city of Mumbai. He also went on to say that considering why they are not really opting for a lockdown option, for 2 to 3 major reasons. Firstly, the death rate is under control, because remember, the situation that we saw last year, about 6 months ago, was really difficult with we were reporting more number of deaths than today. Today we are reporting about 3 to 4 deaths. As far as another reason is concerned, that there is no sort of emergency situation. So as far as the beds, of course, are vacant across hospitals in most of the categories, unlike what we saw 6 months ago.
Right.
So definitely that also situation is not sort of emergency. Most of them are the asymptomatic patients.
All right, Disha, thank you so much for joining us with all of those details. But let's get in some more perspective here. Rajiv Das Gupta, epidemiologist, is joining us on the phone line at this point in time. Thank you so much for joining us and speaking to Mirror Now. Your assessment of the situation in Maharashtra at this point in time, because we are seeing, different ways in which restrictions are coming back. In fact, some parts have gone back into lockdown mode as well, either partial or fully. Do you think that this is the best strategy to curb the spread in cases?
Well, this is not certainly the preferred strategy, particularly at this point in the epidemic, for the simple reason that, as we just heard, the hospitals are not overloaded. The idea of the lockdown is only relevant when the health system is getting overwhelmed. That certainly is not the situation. The ICU beds are available. There isn't any failure of the health system as such. Therefore, conventional testing, tracking, etc., which Maharashtra is doing very well, should continue to be done. The problem is that the lockdown is seen as a behavioral intervention, and that is intensely problematic. The answer to behavioral issues is risk communication, community engagement, and investing in behavior surveys, which we haven't seen. It's exactly a year now. Though behavioral interventions is the mainstay, we certainly haven't seen any serious investment and engagement in that, other than top-down, very, very conventional messaging.
Right. And the other part, like you pointed out, interestingly, that, there's no overload on the hospitals at this point in time. That's exactly the rationale that was given by the BMC chief for Mumbai, saying that that's the reason why Mumbai doesn't need to go back into lockdown. But do you also believe that we might be seeing a difference in the kind of cases, even though they are spreading, but the fact that they could perhaps be less infectious or less intense? Because, even if you compare the data from now versus last year in October, you will see that the number of deaths are much lower. The number of people requiring hospitalization is also much lower.
Well, this has exactly been the experience in the countries in Western Europe, which seen a surge, a second wave, or even a third wave. What basically happens is that the treatment gets more standardized, the diagnosis gets more standardized, and overall the management becomes more standardized, and therefore death rates come down. There is also a caveat to this. If there's the emergence of a new mutant form, which actually carries a higher mortality, then all of this is going to change. Now that is really the task of the epidemiological services, including the laboratory services, the genomic analysis, the molecular epidemiology analysis, and so on.
Right.
And all states and the center are certainly engaged in that. So other than that caveat, and that would be evident should it happen, the conventional, I mean, there is simply no evidence or necessity of a lockdown.
Yes. Yes. And Dr. Dasgupta, one more question I have for you is, the fact that what we are seeing today, we heard even at the Health Ministry's briefing saying that because people are not following the norms in Maharashtra is one of the main reasons why we are seeing a spike in cases. But any perspective on why that's only in Maharashtra? Because, I mean, we are opened up everywhere in the country. And in fact, Maharashtra is perhaps one of the states where the norms, the masks norms are followed more than many of the other states as well. Why would you think that the way the cases are rising and the degree at which they're rising is happening more here?
Well, there are two aspects to it. One is that currently, in this current phase, which is the last few weeks, all states which are relatively more urban are witnessing a higher number of cases. This is equally true of Punjab, the National Capital Region, and so on. The increase in Maharashtra is nothing alarming. If you take each individual city or a district, it is manageable. It is not alarming. And on one hand, we say you have to live with the COVID. If this is not living with COVID, what else is? But of course, this doesn't mean that we give up on the COVID related precautions and all the protocol that goes with it. But this is living with COVID.
Yes.
Just like we are living with dozens of other diseases.
Yes, absolutely, Dr. Dasgupta. That's, very well put in terms of what living with COVID actually means. Thank you so much for joining us with all of that perspective. Meanwhile, at a time when the state and city of Mumbai is facing a massive spike in cases, the mayor of Mumbai attended a large event where no social distancing was followed. Along with crowding, many were seen even without face masks. However, minutes after the event, Pednekar was heard warning people to adhere to COVID rules, else a lockdown may be imposed. Take a look.
ऐसे ही लापरवाही करते रहे लोग और रुग्ण की संख्या बढ़ते तो शायद अंशतः लॉकडाउन लगने की चांसेस है.
Well, talking about COVID norms being violated in Madhya Pradesh as well, norms were violated in the presence of none other than the Madhya Pradesh Health Minister. This on the occasion of Shivratri. Madhya Pradesh Health Minister, in fact, attended two religious events. At both those events, the minister was seen wearing masks, but his party cadre were not wearing masks. Let me, in fact, go across to Govind, who's joining us for more details. Govind, of course, at this point in time, MP is one of the states where even the centre, the health ministry, has sounded off a warning saying that cases are rising. But here we are seeing the health minister, an event where people are not wearing masks.
Yeah, absolutely. As you know, that central government has already clarified that Madhya Pradesh is also one of the states where the COVID surge we are seeing at present time as the COVID cases increasing in the cities like Indore and Bhopal. And now the situation is that more than 500 cases is being recorded these days in Madhya Pradesh. If himself, the health minister, is setting such poor example, should be an inspirational point. But he is himself not following the social distancing norms, and around him many BJP leaders and local public are not wearing masks, and they are also violating the social distancing norms. So this is quite a harassing one. That is why we are just saying it. If himself, health minister, is being the part of those violators who are frequently violating the rules of COVID. As you know that COVID cases are increasing, and the surge is already being recorded in Madhya Pradesh. So this is quite a disappointing one for Madhya Pradesh point of view.
All right, Govind, thank you so much for joining us with all of those details.